The Hospital and Health System Association of Pennsylvania recently held its annual Patient Safety and Quality Symposium, which was attended by more than 250 physicians, nurses, patient safety officers, infection control experts, and other healthcare professionals. HAP President and CEO Carolyn Scanlon talks about the importance of this conference.
Almost 300 individuals from hospitals and health systems from across Pennsylvania have come together for an annual event to review and reflect on patient safety and quality provided in the hospitals and health systems across the state. They are reviewing against the Institute of Medicine's 6 aims of safe, effective, patient-centered, timely, efficient care that is equitable to all.
During a break in the program, we talked briefly with keynote speaker Susan Sheridan and asked her, what are the most important messages you want to leave with the conference participants?
I think one of the most important messages for hospitals and hospital leadership is that is this new area of patient engagement. There's a lot of talk about patient engagement. The Joint Commission has new recommendations on patient engagement. Our regulators, CMS, and other government officials, and our patient safety leaders are all calling for patient engagement is one of the top key concepts to transform healthcare. So I invite and I encourage all the hospitals to really think about what patient engagement means to their hospital. How do they reach out to their community and create pathways for patients to be on boards, on committees, on leadership, and really bring in the patient voice, the patient wisdom, the patient's visions, because that's what's going to help redesign a healthcare system.
Later, we had a chance to chat with 2 panelists who discussed patient safety and quality in an era of reform. And we asked each of them, what is the one thing you or your organization has done to improve quality and safety that you're most proud of?
At Geisinger Health System, our founder, Abigail Geisinger, gave us the directive, make my hospital right, make it the best. So as a leader at Geisinger Health System, we've made great change in proven care methodology. We've transformed care to be able to decrease infection rates, decrease mortality, and have the overall patient care outcome be better than it was several years ago before we made this process change. From that methodology, we've been able to take that and develop a process which we call the GAP process to increase efficiency while we're decreasing cost and increasing quality. I'm so very proud to say that this year we set a goal to save 62 more lives at Geisinger Health System, and we overachieved that goal to 162 more lives saved. These individuals are our neighbors, our family members, and we're so very proud of that. So therefore, we're going to take Mrs. Geisinger's charge, but we're going to make my hospital even better.
One of the things that I'm the most proud of actually began back in 2005 when I met Sorrel King. The Josie King story is something that's become infamous in patient safety across the world. And we had the opportunity at UPMC to be able to implement what we knew as Condition H. Condition H is for us allowing patients and families to directly call for a rapid response team to come and help them. So many times we don't listen, we're too busy, we take issues at face value, and what people need is that fresh set of eyes and ears who can take their issues directly and seriously and solve them for hopefully, the first time the right way. Patients and families so many times will look back on a situation and say, if I'd only. And we wanted to provide them the opportunity to not have to say, if I'd only. We wanted them to know how to be able to call for a different level of help while they were in the organization when they felt no one was listening to them. And so our Condition H program is the avenue we've provided them to do that. And what we have found so far is that well over 60% of those calls would have led to a serious patient safety event if the patient and family had not done that. So we're really proud of that program.
For more information about HAP's patient safety and quality initiatives, please visit www.haponline.org/quality.